Hello, this is Mrs. Buchanan, and I'm here in the nursing lab to demonstrate the proper placement of a nasogastric tube to relieve gastric compression by either fluid or gas or food. Perhaps the patient has an obstruction, and we're going to relieve that by inserting a nasogastric tube. So first we're going to start by picking up our order and verifying that we have the right client and it's the right time and it's the right reason for doing this procedure. And the order says to insert a nasogastric tube and connect to low continuous suction for persistent nausea and vomiting on Mr. John Black. And so we'll go ahead and forego going in the room first. But in the real world, you go in a room and explain the procedure, then get your equipment. But to save time, we'll do that after we gather our equipment. First, I'm going to gather my equipment after I've washed my hands. I know that I will need a gastric sump tube. I have a number 14. It's preferable to do a 14 to an 18 so that you can safely evacuate the contents of the stomach from the obstruction without the tube occluding. Any smaller than that, it would not work very well. I need a stethoscope in order to assess bowel sounds before I start. My gloves. I need chucks to protect the patient and myself from any emesis during the procedure. I need an asepto bulb syringe, and I've got some normal saline fluid in that for irrigation. I need my water-soluble lubricant for lubricating the tip of the tube, and I need my safety pin and my tape. I have my pH strip so that I can measure the pH of the stomach contents to verify that we are in the stomach and it needs to be below 5. I have an emesis basin, and I also have my goggles. So I've got everything that I need. I'll go ahead and gather my equipment up, take it to the room, and I'll meet Mr. Black. Okay, so go into the room, knock on the door. Hello, Mr. Black, how are you feeling today? He shares with me that he's been vomiting and nauseated, and now he has dry heaves. Well, sir, my name is Miss Buchanan. I'm your nurse today, and the physicians noted that you have got a small bowel obstruction that's causing this distension of your stomach and the nausea and the vomiting. And this nasogastric tube will relieve that. Have you had one before? And he says no. And I'll go ahead and just explain that the NG tube, I'll have you swallow when I tell you to, water while I pass the tube down your nose. And it's very uncomfortable. And it might make you feel like you're temporarily choking, like you cannot get your air. It lasts for a brief second, so I just ask that you help me by swallowing when I tell you to swallow, and we'll get past that juncture really quickly, and then it's not uncomfortable or painful. It's just irritating after that. I'll pass it quickly down to your stomach. I'll connect it to the suction tubing here that I have into the suction canister, and you'll see that it'll start draining out the fluid and the gas that's backed up, and you will feel so much better. And he says he understands what I said, and of course I verified my client is Mr. John Black. Will you state your name and your date of birth, please, and his MR number matches. Do you have any allergies, sir, to any over-the-counter medications or prescription drugs or any type of tape like silk tape, paper tape? And he says no. Any allergic reactions to latex or anything else that you can think of? And he says no. My other screening question that I need to ask the client is about any history of bleeding from your nose or any history of bleeding anywhere else, and any facial trauma or a broken nose in the past. And he says no. Next, I'm going to check patency of the nares, so I'll know which nares to go down. So sir, I just close off this nostril, and I just need you to breathe in and out. And I feel a really good exhalation of air on this side, so the left is open. Okay, sir, I'm going to occlude your left nostril, and I want you to breathe in and out. This side is partially blocked. I don't feel much air escaping. So, sir, I'm going to place the tube down your left nares. Okay, I'm going to have an assistant come in and help me with the water, and it's over here. So I'll have the nursing assistant come in with a straw and a cup of water. Well, I go ahead and measure my tube. Now, to measure an NG gastric tube, you will start with the catheter at the end of the tubing at the ear to the nose, and then about an inch or two below the xiphoid process. And I'm going to go ahead and flag my tape my tube with my tape so that you'll be able to see the measurement when you place the tube down, so you don't go too far, or perhaps you don't go far enough. So again, you're going to take this at the top of the earlobe, go to the tip of the nose, bring this hand down and hang on to it, come down, cyphoid's about here, so I'm going to go another inch or so. So I'll put my tape right here, so now I know how far to advance my tube. I need to make sure I have him in the heads up position, and he is. And when I start advancing the tube, sir, I'm going to have you flex your chin down to your chest, and when I tell you to drink water, my assistant is going to have you drink water, and that helps move it through. And again, it will be uncomfortable when it gets back here, but it'll quickly go away as we advance the tube down. We'll tape it down, secure it, hook it up, and it'll be over before you know it, and you'll start feeling relief from the blockage of the intestines. Before I do that, I'm going to listen to your bowel sound, sir. Okay, I just hear some really high-pitched bowel sounds high up and nothing below, so I'll document that your bowel sounds are absent in the lower quadrants. I'm going to put my pan here. I already have my canister hooked up in my tubing. If your assistant will hand me my tubing, I'll have that ready. And I've got the suction over here, and we tested it a while ago and it works, but I'm not going to turn it on until after I verify placement. So I will hook up to this as soon as I get down, but I will not turn my suction on until I verify placement, because that would not be appropriate. I'm going to go ahead and tear my tape for securing my NG tube. There's different ways to do this. It's however works best for you. But I'll tear it down the middle and I'll flag the end here so it'll be easy to take off when I have to rotate it. And I'll just hang it right here. I'm going to go ahead and put my goggles on because there might be a potential exposure to body fluids. Go ahead and put this on. How are you feeling? Well, he's really nauseated. We're going to take care of that. I get my pH strip out and have it ready to dip. Get my lubricant. Got my tape. I've measured. I checked for patency. Sir, I checked your medical record. I didn't see that you were on any type of blood thinner like aspirin, Lovenox, Fragmin, Equius. Are you on any type of blood thinner or chronic use of NSAIDs like ibuprofen? And he says no. So we've assessed that and it's okay. And you're going to just gently stick this into the lubricant. Don't coat it real heavy because it might clog up your tube and it won't drain as well till it melts. So just gently cover the end of it. And once you've done that, you need to put your gloves on. There they are. And I'll tell you that I usually use a big wash basin to set the tip of the catheter in, or the tube in, and not an emesis basin, but this will work. So I'll put the tip of it in here because I know I'm probably going to get contents back. Okay, sir, we're just going to gently start this procedure. You're going to point it down and back to the back of the nose along the side here. And, okay, I want you to bend your head, sir, and swallow. Keep your head bent, swallow. Swallow. Oh, you're doing fantastic. Swallow, swallow. Keep swallowing. You're doing well. Oh, we're there. I've already got contents coming out. So I'm going to go ahead and have my assistant kind of help me hook this up. Okay. So now we're hooked up. I'm going to hang on to the nose here, and then I'll tape it as soon as I check placement. So I dip it in there. I compare it to the color chart here, and it is a 4 pH, so I've confirmed placement. Okay, sir, I'm going to go ahead and take your tubing in place. You'll hold very still. He's already having drainage, even though there's no suction on, and he's starting to feel a little bit of relief. So you can go ahead and take your gloves off. We're going to go ahead and secure the NG tube. Put it on the side of the nares here. I'm going to go under. And then I'm going to pinch it here to secure it. I'm going to take the other side and do the same. And we'll pinch it again to secure it. And sometimes, I wouldn't say just sometimes, usually you need to put one more piece across the top. There we go. Okay. Now I'm going to go ahead and turn on my suction because I verified placement. So you'll need to walk over here and say that you set it on the correct order. So we have it on low, continuous. So you turn your dial up to low continuous. It's draining out. You're going to note the amount. I'm going to say I got 600 out of a green, yellow, bile-colored substance with some particles in it. So that is working well. Now I want to secure it with my safety pin. Okay. All right, I just did that backwards, so we'll redo it. We're going to put this on the tube itself. Okay, now we got it. I'm going to flag the end so it'll be easier to remove. Okay. I'm going to come up here. It has to stay up over the shoulder for it to drain properly. Let's see, I think he's got enough room to turn his head. So you'll just put the tape there. Then we're going to take the safety pin and go through that tape and fasten it to his gown. So now I have secured it. And how are you feeling, sir, other than the back of your throat might be sore? And he says he's already feeling better. And then you're going to go document that you placed the NG tube, what size it was. This was a number 14. Insert it in the left nares without any difficulty. Immediate return of 600 cc's of green, yellow, bile stained secretions with some undigested food particles in it. And that he tolerated the procedure well. And it is connected to low continuous suction per order. And the patient is already expressing some relief from discomfort. Of course, when I got finished, I washed my hands before I documented. Now, this is not part of the skill, but I want to go ahead and demo how you would irrigate this to keep it patent every 2 hours. So I'll put some gloves on. I still got my goggles on, although I could have taken them off. But since I'm taking this apart again, I'm going to keep my goggles on. And we're going to irrigate this. You typically will expect in order to irrigate every 2 to 3 hours with 30 milliliters of normal saline. Don't use sterile water. Sterile water can dilute down the contents of the stomach and cause the electrolytes to change. So when I come in, I'm going to come up here. I'm going to take this apart and then I'll let it suction into the canister. And that way, because if you turned it off, it might spill everywhere and make a mess. I'm going to squeeze my bulb syringe so that when I let go, it's going to put fluid up into it. Because I cannot push anything through without checking placement. So I'm going to hook it up, and I'm going to release, and I've got my fluid. I'm going to maintain that in upright position. Squirt this in here. Take my pH strip, test it. It's a 4, so I can go ahead and irrigate now. So now I'm actually going to squeeze a septal bulb syringe and pull up 30 milliliters of normal saline. I'm going to connect it to here, and I'm going to go ahead and push in the 30 milliliters, and then I'm going to disconnect and hook back up to suction. Okay? And then I'll count that 30 milliliters as my intake, and then whatever comes out during the shift, it'll be fine. And that way you'll be more accurate on your output. And the patient expresses that he's still doing okay. If he's uncomfortable, I will tell him that not to talk much because he rubs the back of your throat every time you talk and it makes it hurt more. And if he wants something for a spray to numb the back, we can see if we get an order for it. He's allowed to have ice chips, but sir, do not cheat on the ice chips. I'll bring them to you. Use them sparingly because anything that you take in is going to be suctioned out into the canister, and it might look like you have more of an obstruction if we start seeing a lot of drainage out. when maybe it's resolving and what we're seeing is what you're drinking. So be very careful and disciplined about sticking to the ice chips until we advance your diet and get this, or get the tube out and advance your diet. And he expresses he agrees. Is there anything I can get for you right now, sir? And he says no. I want to make sure you have your call light where you can reach it. Anything else you need right now? Do you need to have your bed back down a little bit? And he says yes, so I'll put him back down a little bit. Nausea is gone, so I don't need to give him anything for nausea, and the pain is down to a 1. Okay, thank you, sir. I appreciate your patience with me, and I'm glad that you're feeling better. So then I will get rid of all my stuff, dispose it in the proper areas, and wash my hands and exit the room and document. That's the end.